This tutorial will review the ergonomics of the clinical exam. The clinical exam is actually a very ergonomic procedure because you want to fill out the diagnosis page contemporaneously as you perform the clinical exam. And if your team works together and works ergonomically, it's completely possible to do this while you work, not after the fact. So part of the clinical exam is the soft tissue exam, the oral cancer screening, the muscles of mastication exam, and the TMJ exam. This is how we start every case with this type of exam before actually looking at the tooth that's circled on the referral card. So during this exam, the assistant can actually fill out a large part of the clinical examination diagnosis form. And this greatly simplifies the doctor's job when they go to actually complete the form. The form is already partially filled out by the assistant as you work. So being able to do this really simplifies the whole procedure. So you want to develop consistent procedures in everything you do in your office. And this will greatly simplify what your assistant does. If you do it the same way every time, this gets really, really easy. It's when you don't do things consistently that you end up having a problem. So here's an overview of us in speeded up time of actually doing a clinical exam. I'm examining the lips. I start on the outside and we go in, examine the gum tissue, the attached gingiva, the unattached gingiva. Notice I'm moving the chair. I'm looking at the entire dentition. And during this time, Joy is entering some data that I call out to her as I'm looking. Now I'm going to do the tongue and look under the tongue and at the floor of the mouth. And if I see anything, then I'll mention it to Joy and she'll click it off right on the diagnosis page. We'll review this in detail later in the video, but this is basically us doing a clinical exam, and we do it the same way every single time. It's just like starting your engines drill or the parafocalling drill. Consistent processes, consistent schedules in everything that you do. We do a lymphadenopathy exam, and while we're actually doing that, Joy is entering. If there's any lymphadenopathy, she will go ahead and enter that in the chart contemporaneously while we do it, not later. You don't have to rely on your memory to fill out any of this form. There you can see Joy is actually filling it out. All of this is within TDO and very easy to do contemporaneously. This is not difficult if you have a consistent way of doing it. Here I'm doing a temporomandibular joint, seeing if there's any pain in the joint, and Joy measures the opening at that time. We measure the opening on every single patient. So here's some examples of the kind of things that we look at. If I see this, I tell Joy there's occlusal trauma. If I see this, I tell Joy there's leukoplakia on the lateral border of the tongue or the floor of the mouth. She enters it as I'm doing it, contemporaneously as I'm doing it. This is so simple and easy to do if you work as a team in doing this. There you can see a laceration on the tongue. I tell Joy I believe that's a traumatic laceration of the tongue. So we enter all of this stuff while we do it. There's a fluctuant swelling. And I just mentioned to Joy, there's a fluctuant swelling above the tooth. Or I'll say, Joy, there's abfraction lesions. This is kind of a generalized finding. If I see abfractions lesions, um, we enter that into the record. Fractured crowns, same situation. Discoloration, if we're doing a root canal and a tooth, we note that there's discolorations. Here we notice that there's a sinus tract. We enter that. Where is the sinus tract? And we ask the patient, how long has that been there, if they know. Here you can see perhaps a sinus tract draining through the sulcus as well, and how long it's been there. So this is very easy to do. If you train your team, there's the tori. If there's tori, you enter that. Here's a herpetic lesion. Same thing. You do this while you are working. Class 3 FERCA. So you notice all of these things on the tooth that you're doing. And if this is involved in the tooth you're treating, you certainly want to make a note of that. All of these things affect the diagnosis of your case. Everything affects the diagnosis. Sometimes when you're doing the oral cancer screening, soft tissue exam, it's difficult to look at everything with these smaller mirrors. So typically during the exam, we will have intraoral photography mirror, and that makes it much, much simpler to get an overall view of the palate and mandible as well. So instead of doing it like this, we'll take an intraoral mirror, and now I can see the occlusion, I can see the pharynx and all of the maxillary palate, and it makes it a lot easier if you can learn to use an intraoral occlusal mirror. And it also makes it easier to document. As you get good at this, you'll be able to document it contemporaneously as well. Initially, it will be hard, but after you develop a consistent procedure, you document and you photograph it at the same time. We've done this way for years. So if you look at all of those cases that I've just shown, they're different patients, but if you look at all of the boxes that might be checked during this. So by the time the clinician goes to fill out the clinical examination, a lot of the form has already been filled out by your assistant, and it gets a lot easier. I can do an entire diagnosis page on the vast majority of patients in 90 seconds to 2 minutes, very, very easily. So that's the ergonomics. Work with your team on it and see if you can really perfect this.